Good afternoon, and thank you for joining us for the Flint Community Webinar on Coronavirus. This is week 79, September 17, 2021, and we're excited to be able to be with you this afternoon for this webinar. This webinar is sponsored by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. Today, I'm again excited to be your moderator, Yvonne Lewis, one of the co-directors of the Healthy Flint Research Coordinating Center. The Healthy Flint Research Coordinating Center is here to help bring relevant information to you through our community academic partnership. We are really thrilled that every week we have an amazing array of partners that are available to support in this effort. Every week, panelists are behind the scenes, one of these organizations ready to answer questions for you. And some have asked, why did we begin this webinar 79 weeks ago? Because as the coronavirus was becoming more relevant and clear to our community, I should say, we wanted to make sure that we were bringing information that was credible and relevant to the residents of Flint, Genesee County. How could we bring forth information that would help us respond appropriately to the resources and services that were available to us? So we continue that even today. Want to let you know, if you are listening to us, if you've joined us by YouTube or we're live on Facebook, please share and ask someone that you might know, invite them to be a part of this today, because we have some incredible information that we will bring to you from some of our partners. If you are in the webinar, please be sure to put your questions in the Q&A. Go down to the bottom of your screen, put that question in so that we can get those questions answered for you today. If in fact you're not able to join directly in the webinar, but you have a question, you can give us a call at 810-835-2130. Again, that number is 810-835-2130, and ask that question. We'll be certainly able to get the information so that we can respond to it. Or you can send any questions in at any time to info@hfrcc.org, info@hfrcc. We want to acknowledge all of you that are community members. We thank you for sharing with us the value of the webinar to you. And so we want to continue that process by bringing this relevant information to you today. Our focus today for this webinar will be, what do we need to know about COVID booster shots? A lot of questions around that during the week. And we've seen people already getting their third vaccine, and we'll talk about that a little bit more. We've been asked the question, why is the Delta variant so contagious? We hope to have some clarifying information for you today. And one of the things that's been really, really important, we've talked about our children. And what do we do to protect our children? We'll also hear an update from the Genesee County Health Department, from the governor's office, and an update from the city of Flint. So again, join us in this conversation, put your questions in, and we'll be delighted to answer them for you. I want to ask our roundtable team to come forward today, because we're going to talk about this issue. How do we protect our children? So Dr. Reynolds, Dr. Hackert, Dr. Deborah Verholden, and I see you up there, Katie. You might have another tip for us today, but we're excited. I want to just really get this kicked off. We had some conversations last week about a number of things. We were asking about the mask and why that's so important. And I know, Dr. Hackert, you shared with us a little bit about the mandate or the recommendation that you made about masking. And then I want Dr. Deborah, she's going to come back and she's going to share some really interesting things for us, especially as it relates to how our children are beginning to interact in the schools. So let's start with you, Dr. Hackert. Can you just give us an update on where we are?
It's a world of coronavirus out there. More specific questions might be a little easier to answer, but where we are still seeing our numbers go up. There was a very good study out of the University of Michigan showing that in Michigan counties that had mask mandates were not going up as fast as some of the ones that are not using masks. And that's nice to see the actual data on that it does matter, because we knew it did, but it still is helpful, I think, for everyone to be able to see it. And with the Michigan MySafe coronavirus tracker, which I could probably find and put in the link, or maybe Sherelle could. It's very interesting to click on the ones around us that are not using mask mandates. We have had increasing support and compliance with mask mandates in the schools. I am very, very happy to report. And I know we were going to bring up part of the last question that had gotten answered at the very last moment last week, but I am sorry, I ran from one meeting to the other, and so I don't remember what that question was.
So Dr. Hackett, one of the questions that they wanted to know was, so we've got this mandate. So what are the ways that this can be enforced, and what happens if people are not utilizing the mandate that you put forward?
So that is a large question that has to be actually addressed on individual case-by-case basis. We have asked that the schools do not let people in who are not wearing masks. And so when the schools are complying with that, that's when we need to look at that and like different ways that they can prevent children from staying in school if they do come in, or they come in and take off. Let me see, they're trying to restart my windows, so no. If they do come in and take their mask off, then we work with the schools to come up with ideas on that. But there's so many different ways that it can be enforced. It really depends on whether the school's trying to enforce it, whether they're not, whether there is a clear transmission occurring in the school, or whether the children are coming into schools. If the cases are going up in a particular school, are they getting it in the school, or are they getting it outside of school? We really have to look at it individually, and the reaction of the health department and the local law enforcement would be dependent on what we're seeing as to why that's not being enforced.
Right. And one of the things you did say last week, Dr. Hackett, which we want to encourage our parents to do, and those that are working with parents, please ask them to contact the school directly and get information from the schools, because that's where they're really going to get the best information. As we learned from Tricia Hill, who was at the GISD, each school makes their own decisions. And so it's really important for us to connect with our school system, that particular school system our children are in, to understand what their processes are. Dr. Deborah, let me jump over to you for a minute. We were talking a little bit earlier, and we've had outbreaks, and we've had people who were vaccinated, tested positively, and so now the questions are, what about quarantine now, and what the process we should consider when we're thinking about being exposed, because there's a lot of exposure happening right now.
So this is a really great question, and it's so relevant and timely for what's happening in the schools. And the short version is this: there's a different protocol that you have to follow depending on whether or not you're vaccinated, whether or not you're masked, and whether or not you're practicing physical distancing, that 3-foot or 6-foot distance between you and others. So we have this great graphic. It's also included in our weekly health equity brief that people will be able to see. The graphic is, oh, here we go. Thank you so much, Heatherlyn. So the graphic, let's just walk through it real quick. If you are fully vaccinated, that's that teal green color. If you're fully vaccinated and you are less than 3 feet apart from somebody, you are 3 to 6 feet and unmasked, or you're 3 to 6 feet in mask. So really, regardless of the distance you are from somebody, and regardless of if you're masked, you do get to stay in the classroom. Here's where it gets tricky. If you are unmasked, no matter how far you are from the potential exposure, you have to get tested at least once on day 3, 4, or 5, and then you got to monitor your symptoms for 14 days. But because you're vaccinated, you can stay in the classroom, but you do have to get tested. And the reason you get tested on day 3, 4, 5, because that's about the time from when you were exposed that you would have accumulated enough viral load to come up positive on a test. If you are fully vaccinated and masked, you get to stay in the classroom and you just monitor your symptoms for 14 days and just make sure that you don't have any symptoms. And clearly, if you have symptoms, you would go get tested to confirm that in fact you have COVID. Here's where it gets really tricky. If you are unvaccinated, and that's both the COVID positive person and the exposed student, right? So let's say you're unvaccinated. If you are masked, even if you're unvaccinated, if you um, if you are less than 3 feet apart, both students are masked. If you are 3 to 6 feet apart, both students are masked. Notice the common denominator here is if you're masked, you can stay in the classroom. Why? Because that mask is a layer of protection that gives us a certain degree of confidence. So you can stay in the classroom if you are masked. But if you're unvaccinated, you've got to, and you did not practice the distancing, you've got to get tested daily for 7 days in order to be able to come back to school. And then you have to continue to monitor those symptoms for another 14 days. So if you're unvaccinated and not practicing the social distancing, but you are masking, you still got to go through that daily testing and symptom monitoring. If you are unvaccinated and masked and practicing the distancing. So you've got these 2 layers of protection, right? Let's go back to that Swiss cheese model, right? No one layer is perfect. The vaccine's not perfect. Masking's not perfect. But as you start to pile those layers on, you build this wall of protection. If you are distanced and masked, you can stay in the classroom. You have to monitor your symptoms for 14 days. If you are unvaccinated, it doesn't matter if you're practicing the distancing. If you are unvaccinated and unmasked, if you have an exposure, you have to stay home for 7 days. You have to stay home for 7 days, and you can return after you've had a negative test on day 6 or 7, or you can come back after 10 days if you don't get tested, if you have been asymptomatic the whole time. So the point is, if you're vaccinated, masking, and distancing, basically our children will be able to return safely and not have a lot of disruptions to their education. And we know the kids have endured a lot. So the key is, let's use all of those layers of protection in schools, both with the teachers and the students and the staff, everybody in the building. Because the way to keep kids in class is for them to be vaccinated, masked, and distanced.
Thank you, Dr. Deborah. Dr. Reynolds, you were sharing with us earlier some of the things that, are from a personal experience, and you always have such an affinity for children. How can you help parents? Because one of the things we say, sometimes parents are feeling really bad about what's happening. We don't want to demonize parents for the decisions that they make. So what advice would you give?
Number one, we are in the middle of a pandemic. And sometimes when we make our best informed decisions, it does not give us the exact result that we want. And so you cannot blame yourself for it, but we can learn from it. And we can also decide to be more cautious or check with someone who has more experience, like looking at those school guidelines that are published by our health department, asking our school nurses, or calling the health department or your health provider for clarification. And please don't guilt yourself. Now, what happened in my family space last week was, remember, I told everybody, when you are in school, your child is in school, make sure your contact information is accurate. Make sure you have a secondary phone number. And when you hear that phone ring or you get that email or text, please respond. If you have any question, contact your preschool, school, or job or health department, if that's the number, to get the information that you need, because they may be calling you to tell you that your child has been exposed. Mm-hmm. And in that case, you have to get tested. And so what happened in my family space is the mom took her son to get tested, but she also got herself tested. The son was asymptomatic, but positive. So he had to go into isolation. We're talking about preschoolers. Mom was negative, but she had to go into quarantine. So it gets complicated. And then when you take your children to another family member's house, even if it's just for brief babysitting, more than 15 minutes, then those people with whom the child has had contact must be tested. And my wife and I visited outside because I drive my wife crazy being overly cautious, but it was a beautiful day too. And so we ourselves got tested 4 days later. So when in doubt, get tested. If you have questions, get tested. If you need more information, contact your health department. If you're good at reading long directions that appear to be complicated, read them and then ask somebody. But this is not a burden that you bear alone. Now, may I go to routine immunizations? I'm the oldest family member besides my mother alive in the US, okay? So my youngest niece calls me. She has 2 children and, of course, a preschooler. And she was concerned about measles, mumps, rubella shot causing autism. Now, I thought this had been put to rest years ago because the author of this paper, which cited inaccurate, untrue information, was actually prosecuted by the British government for faking his data and presenting things that way. But it never goes away. So I had to remind her. I said, look, honey, who do you think gave you your first MMR? It was me, your uncle. And I, plus my colleagues, have given tens of thousands of MMRs. And I will say, within the experience of me and my colleagues, I have never seen a case of autism. Now, many times people will say, because I got this shot, I got this condition. And there may be some truth to it, but also, you may get a shot and then get in a car accident. No one says that a car collision is related to the immunization, but sometimes we carry events that have some time association, but no real clinical or scientific association. So we have to remember, what do we gain? And the second thing I'll say about that is, you've heard me say this before. When I started training, we actually had homes, long-term care homes for children who got measles, mumps, rubella, or these long-term complications. If you want to talk about things causing sterility, mumps can cause sterility. Okay, that's why part of the reason we give immunizations against it. Rubella can cause fatal congenital conditions or long-term conditions, so that require not care at home, but required care in a facility. And many of our parents, my niece's age, and I'll say even up to age 50, have not seen these things. And I'm not trying to scare folks, but I can tell you at the beginning of my career, before meningitis vaccines for a particular type of meningitis, I would do a spinal tap, and instead of the spinal fluid coming out like clear water, it came out like custard, because there were so many infection-fighting cells trying to fight off the infection, and it does cause long-term damage. So unless you've seen these things, perhaps you can't get as worked up as the average pediatrician, health director, or family practice doctor does. But these are things we really need to protect our children against. And you don't want to have to wait to see it. Please get your immunizations up to date.
Thank you, Dr. Reynolds. And I think there are people who would agree that it's important to get this information. Now, between you and Dr. Deborah, you all gave out some other terms about I think Dr. Deborah talked about quarantine, and there was conversation about isolation. We'll have to come back and remind us about these. We talked about them a lot in the first phases of the COVID virus, but we're back in that place again where we're trying to figure out what's the difference between quarantine, isolation, and then just making sure you separate and get tested. So we want to encourage you, please pay attention. Ask questions, put those questions in so we can get those questions answered for you. Just want to go one more round, Dr. Deborah, Dr. Hacker. Any key things you want to say to us before we move out of the round table?
So this is something I think is a great way to think about the difference between Delta variant being so contagious compared to the other ones. So you see that it's like twice as contagious. And if you use this thought, ask someone if they would rather have a penny today and then double that every single day for 1 month, and take whatever is available on day 30, or would you rather have $1 million today? And most people, including my engineering husband, said, well, I think $1 million, but since you're asking, it must be a trick. But it's actually over, like, what is it, over 3 or 5 million? It's a lot more if you wait a month, and because that's how much difference doubling makes. And so when we look at our case counts in the United States, in July, we were in low. Back in May, we were kind of in low. In June, we were sometimes having 0 or 1 case a day in the whole county. And that's when we did not need to wear masks. But every time I talked or wrote about masking and how we don't need to do it right now because there isn't cases in the county, you know, we could do it in places where someone is immunosuppressed, or you're particularly concerned about a child who isn't possibly getting vaccinated. It's still, we didn't have it in the county. And so now we're having, you know, dozens of cases a day, and we hit over 200 cases per 1,000 or per 100,000. So we have about 800 cases right now, 900 cases a week in the county, compared to like under 10 back in May. And that's that whole doubling thing. So if anyone offers you a penny and double it every day, you want to make sure to take that one and the other one.
Thank you, Dr. Hacker. Dr. Deborah.
I love it. It's actually over $5 million that you'd have at the end of 30 days, Dr. Hacker. The point that you made about isolation versus quarantine is a good one. I know we'll go into detail about it in the future. But the short version is isolation is where you go when you know you have COVID. Quarantine is where you elect to go, and they look very same. To a fly on the wall, they would see someone in quarantine and someone in isolation looking very, very similar in most cases because of the realities of how we live. But most of those things rely on the honesty and the goodwill of people. And I've grown and I've learned a lot during this pandemic that some of what I thought was ill will is not. It's just bad information. It's misinformation. I think of information as goalposts. People have a little bit of information here and a little bit of information here and maybe a little bit of information here. But how they string those three things together to make decisions about their health and their health behaviors for them and their family is where the problem has come. And they've jumped from goalpost to goalpost. And there's a crater, like a huge big gap in between those little goalposts where they just don't have good information. And so I just want to reiterate the same point we've been saying. The vaccine, it's not going to solve all of our problems, but it is in your best interest. The vaccine is the best thing that we can do as a society right now. It's the best thing you can do as a mom for your children. It's the best thing you can do for your children if they're eligible to get them vaccinated. It's the best thing you can do for your elderly loved ones. It's the best thing you can do for yourself. So I just encourage everybody to get vaccinated and continue to wear your mask. Wear your mask. And I'm, just because I try to model the behavior, I've had dinner with some of the fine folks on this call. And you know what we did? We opted to sit outside. Why? Because outdoors is best. We sit outside. The tables are spaced out. There are ways for people to safely engage. So just do that. Get your vaccine. Wear a mask when you're indoors. Avoid those large crowds. Continue to practice that good hand hygiene, which we should just all be practicing for the rest of our lives. Not obsessively washing our hands, but just good hand hygiene and being mindful and practice that physical distancing, not social distancing, the physical distancing, watching the distance between you and others. If you do that, we can get on the other side of this.
Thank you, Dr. Deborah, Dr. Reynolds, and Dr. Hackett. Appreciate you so much. And there's always going to be opportunities for you to share more. As we move forward, we have Gary Jones here from the state of Michigan. Gary's going to give us an update from the governor's office and tell us what good things we need to know out of the governor's office. Gary.
And thank you, Yvonne, and good afternoon, everyone. So the governor recently announced her My Healthy Communities Plan, a $1.4 billion proposal to expand care for families, build up facilities, and invest in local public health with federal relief dollars from President Biden's American Rescue Plan. The plan will address many of the deficiencies in Michigan's health infrastructure that were revealed during the pandemic and provide resources to meet Michigan families' mental health needs, expand access to behavioral health care and telemedicine, upgrade nursing homes, and bolster local public health departments. The governor also issued the following statement. I'll read a portion of it. After the release of Michigan's August unemployment numbers, the state's unemployment last month was down to 4.7%, below the national average and the lowest level since March 2020. Our unemployment rate is below the national average. Businesses are staffing up and personal income is up 19.1% year over year, the fourth highest nationwide, end quote. The governor also was joined by state, local, and university officials recently at Kettering University, the Mobility Research Center in Flint a few days ago, to announce the first round of Michigan Mobility Funding Platform grants. Five mobility companies, including Flint's own Commute, received more than $444,000 in funding to help with mobility pilots throughout the state of Michigan, and also to help us accelerate electric vehicle adoption. The governor also recently signed Senate Bill 400, which strengthens expungement legislation that the governor signed recently as last month for a first time violation of operating while intoxicated. The governor was quoted saying no one should be defined forever by a mistake they made in the past. Senate Bill 400 strengthens recent expungement legislation I signed last month to allow an estimated 200,000 non repeat OWI offenders to have the opportunity for a second chance at a clean record. All Michigan families who are eligible for food assistance benefits are receiving an additional monthly payment in September in response to the COVID-19 pandemic. The Michigan Department of Health and Human Services recently announced eligible clients will see additional food assistance benefits on their bridge card from September 18th, beginning tomorrow, to September 28th. And lastly, michigan.gov backslash COVID vaccine, as well as michigan.gov backslash coronavirus, still the best catch-all websites to keep updated.
Thank you so much, Gary. And I think this is good news for some of our families. And I know for those of you that are actually out and about, you're talking with families, they may not get this information right away. So you who are in the webinar and get this information, help us to spread the word so that our community members know exactly what is available to them. Thank you so much, Gary, for making us aware of what's happening and coming from the state in these matters. We're going to go right now to our health department, Sherelle Brown, who is the emergency preparedness health educator. And not only is she out health educating about emergencies, but she is talking about what's happening with Corona. Sherelle, I know there's a lot going on this week, and we've heard a little bit of the update. Please give us some more details.
Yes. So currently in Genesee County, our COVID-19 transmission rates remain increased. So they're high, and we are encouraging all who have not been vaccinated to get your vaccine. Throughout Genesee County, overall, there has been over 340,000 first doses administered, and about 44.6% of residents 12 and older are fully vaccinated in Genesee County. So we ask that you continue to come out and get your vaccine. In the past week, our new trend cases have increased by 6%. In prior week, we saw 481 confirmed cases, and now we're looking at about 510 confirmed cases. So it's still going up. Our positivity rate has reached 11.7%. And this is why we have that K-12 mandate in our schools, because our transmission rate is still high. And we're also seeing outbreaks of COVID-19 in the schools as well. So get your children vaccinated, adults get a vaccine. We have our upcoming clinics with the red asterisks. Those are our standing clinics. You can visit those every Tuesday, Wednesday, and Thursday. Tuesdays, we are located at Our Lady of Guadalupe from 12 to 2 p.m. where we offer Pfizer and Moderna. Wednesday at the Central Church of the Nazarene, where we offer all 3 vaccines, the Pfizer, Moderna, and Johnson & Johnson. And then on Thursday, we are at Shiloh Missionary Baptist Church offering Moderna and Pfizer. If you've received your first vaccine outside of Genesee County or through a retailer, you can come to one of our clinics to get your second dose. That's no problem. And then we have a pop-up clinic as well on next Wednesday. If you can't come out to Central Church of the Nazarene, right downtown at U of M, Flint Pavilion will be there from 1 to 5 p.m. And there will also be offering all 3 vaccines. Next slide. And it's still important, as always, to get tested. You can visit our website at gchd.us, where we have specific locations for the local Rite Aid and Walgreens that you can visit. And then we also have Word of Life Church, Bethel United Methodist Church, and Macedonia Baptist Church. Those are offered on particular days, so you want to make sure that you walk in or book an appointment for the day that they are open. And could you go back to the last slide? Because I just got some information Tuesday that at the Genesee Community Health Center, they are only offering testing internally. So that is not open to the public for free vaccines, just so you know, but you can go to Hamilton Community Health Network if you need to get your test done as well. And as always, we are available at the health department to serve our homebound residents. So if you need to get your vaccine and you cannot visit one of the walk-in locations, please contact us at 810-344-4800 or visit gchd.us for more information. I cannot hear. Oh, you on pause?
Yeah, sure. Yeah, Sherelle. Let's go back to that slide a minute, Heatherlyn, if you will, and help me if I'm correct about this. But I understood that now at the testing sites, particularly at the church testing sites, there will also be vaccine opportunities. Is that correct?
That is correct. And there will be lots of pop-up sites, even on the weekends. And I'll be sure to add those to our presentation every week so that you're aware of what's going on a Saturday and possibly Sunday, or our multiple clinics throughout the days that happen during the week.
Yeah, and let's just take a quick minute to give a shout out. There were a number of community organizations and agencies. I think a few weeks ago, we talked about the rapid response opportunity that the United Way put forward to have community organizations and agencies working in our community to really get in some of those unique spots. And that proved to be really, really exciting over the last few weeks. So we're looking forward to hearing more about those actual pop-up opportunities that are happening in addition to what you're seeing here on the screen. So please, again, help us get the word out. I don't know if you recall, but when we first started talking about testing and vaccines, there was a lot of concern in our community that there was not access. People were looking for opportunities and there weren't access. That has been remedied. And so we want to be sure that our community members know if they want to get the vaccine, because this is your personal choice, but we want to make sure that the access is available. So thank you, Sherelle, for making sure we get this information on a weekly basis.
Thank you. And it's available and free. So come out to one of those sites and get what you need. Testing, vaccines, we've got it.
Let me ask, right where we're at this testing point, there's a question in the queue that I'd like to have Dr. Hackard or Dr. Reynolds answer. The question is it okay to mix the vaccines? Because we've had this question come up before, and this is with respect to mixing J&J, Moderna, or Pfizer. Can we answer that right while we're in this spot? Dr. Hackard?
Yeah, right now they're saying, no, don't do that. If you do not have access to the vaccine that you were going to get, that you already had gotten the first dose, you can get it, a different one, if that's all that's available. But we know that there are lots of options to get all three of the vaccines right now in our community. So right now it is not recommended to mix it. I have personally okayed a few of people who got vaccinated with their first dose in another country, and we do. So I've looked all that up, and they don't really have a strong reason why you can't, but they haven't investigated enough to know if it's going to be as effective as the parts that they've studied, which is to use the same vaccine. I do want to just point out that some of the questions that are still coming up, like the booster dose, the ACIP is meeting this actually today from 10 to 5 to address those exact things. That's a group of, is it 15 or 16, mostly physicians or PhD researchers. I do know that we have one person on it who's an attorney from MSU. I worked with her when her daughter died of pertussis, and she became a strong vaccine advocate after that. So she is also one of the panel members, and they are meeting exactly today, like right now as we speak, on what guidelines should be controlling for the booster doses, because we have heard so many different things. We heard in August, presidents say, get your vaccine boosters. You still hear that now. We've been told as doctors to make the distinction between a third dose of vaccine for people who are immunosuppressed, as opposed to a booster dose for people who are not immunosuppressed. Is it a different vaccine? No, exactly the same vaccine. But if you're immunosuppressed, we're supposed to call it the third dose. And if you are not immunosuppressed, it's supposed to be a booster dose. So they're trying to come out with guidelines for that. And things that they're looking for are age cutoffs, different disease risks, and things like that. So next week, we will have an answer as to what the current guidelines are going to be for booster doses. But right now, it is still right now happening live. You can actually go on and watch it too. Just Google
Thank you so much.
ACIP meeting.
Thank you so much, Dr. Hacker. These are, and I appreciate you putting the questions in the queue, because these are right now concerns for people. And so we are thankful that we have this opportunity to have our own local experts help us to understand what's going on. So this is right now information. So please stay tuned, come back and visit us in the webinar, participate in the webinar next week, and we'll have more information for you. Dr. Deborah, you mentioned earlier you want to give us some more facts. So please help us to know those important details about where we are with our cases and what that means to us from an equity perspective.
Yeah, this is great. So I think data is and knowledge is power. We are continuing to increase. Case counts have increased for the 11th consecutive week. That's both in Flint and Genesee County. The recommendation from the CDC is that all Michiganders wear their masks indoors, in public, and outdoors if social distancing isn't possible, regardless of your vaccination status. And that is due to the high transmission rates across the state. And Genesee County and Flint are no exception to what we're seeing in the state. Our testing positivity rate, that's of the people who get tested, what percentage of them are positive, that number continues to go up. We've added something new this week to the case counts. Again, this is a recommendation by the Department of Health and Human Services. You'll notice there's a new box, and it's a white box. And I'm really glad to see this box, and it's called probable cases. About a month ago, we added something called lag cases. And the reason we put the lag cases in and specifically identified them is because we will lock and load the case count at the end of a week, right? So we're reporting to you right now cases from the week that started September 5th, okay? So, but after that week ends, in the week or two that follows, some additional cases will come in. Those are called lag cases. We have those here in gray. What we are now looking at and trying to track are what are called probable cases. And I think this is really going to give people a better sense of the extent of, the spread and the transmission of this virus in our community. And a probable case is somebody who has either had the symptoms but not been tested, or had a known exposure but did not get tested. Because remember, a known exposure and symptoms and did not get tested. Because remember, the only way to be counted as a COVID case is through a COVID test. That's how you get counted as a COVID case, is when you get a positive COVID test. So these probable cases are cases that likely were positive, but they didn't get picked up anywhere in any of the formal systems. Go back and look at the week 79 last week. Likely in Genesee County, 214 probable cases. That's above and beyond the 300 plus cases that we know we had. We likely also had an additional 214 cases that are probable, but that just simply they did not get tested. So the reason we share this with people is to really give people a better sense of the extent of the problem. When you start to add those numbers in, it looks like last week in the city of Flint, we had closer to 100 cases. Right? What we reported last week was, maybe 75 cases. I think it was somewhere on that order. We had to add an additional 25 cases that came in vis-a-vis testing over this current week, and then an additional 16 cases that are probable cases that weren't tested. So my point is, this is our best effort to try to give people the truest extent of the problem. And the numbers are not in our favor. We already talked a bit about these different scenarios around if you're vaccinated or unvaccinated and you have a known exposure in school. The only thing that I would reiterate here is the most important thing is for people to practice the multiple layers of protection. Get your vaccine, practice distancing, and wear your mask. If you do that, our kids will be able to stay in classrooms and simply monitor their symptoms. That is going to be what's going to be best for us, and it's going to be what's best for our students. Since Mary Catherine is on vacation, yes, I'm putting her out on Front Street. She is in Hawaii, soaking up the sun. I did ask her to bring me back a few sprinkles of sand and a nice big can of sunshine. I'm going to stick my face in the can of sunshine and throw the sand on the floor and run my feet through it for a minute. We got these recommendations from policymakers. The first is to mandate masks in schools. We need that to happen at a state level, not just at a school level or local level. We already saw what happened when we got these bold, courageous leaders like Pam Hackard, who jumped out on the skinny branches and said, I'm going to do it because this is what we need in the county. And she did that in the absence of no support from the state. We need those things to come up from on high, because what has actually happened is a whole package of House bills 600, 601, 602, and 603 have all now made it out of committee, and they will be going to the full Senate for consideration. And it basically will give schools the authority to ignore mask mandates for kids. I don't think that's going to be a good thing for anybody. So we need our policymakers to mandate masks in schools and not continue to kick that can down the road and put it on the shoulders of our local officials and our local health officers, et cetera, whose job it is not to make laws. Our legislators, their job is to make the laws. Second thing, we want investments in Michigan's American Rescue Plan Act funds to improve community health. And Gary Jones told us a bit about Governor Whitmer's Michigan Healthy Communities Plan. We need all of our policymakers to get behind that. It's good public health, it's good public policy. And the last thing is we need our policymakers to help Michigan renters. We've got thousands of Michigan residents who are struggling to afford rent. The CDC had this moratorium on evictions. We also had one in the state, and the Supreme Court has struck down the CDC's ability to continue that moratorium. What that means is a lot of people who are potentially already unstably housed, because even if you have housing, but you've got this looming fear of eviction over your head, that's a hard place to be in. So we need protection for Michigan renters, and we also need better improvements in the emergency relief assistance funds that were made available to Michigan renters and eligible households, that the grantees of those dollars, the people who are pushing those dollars out, are really held to account to accelerate the pace at which they get that money out and make sure that it gets into the hands of families and it gets into the hands of renters so they can get it into the hand of the property owners, because everybody loses when people are evicted and when people don't have the ability to pay their rent. Whether you be the person that owned the house or the person who's renting it, everyone loses. We have the resources. Let's hold people to account. Let's help our renters, and let's help our land, our owners out of this problem.
Thank you, Dr. Deborah. Appreciate that. You standing in for Mary Catherine. We all probably would like a little bit of that sunshine when you get it coming your way and saying,
Yeah.
this is so important. We can have things talked about at the state level, at the local level, but we also need to know what's happening, at the federal level and at the state level, but we also need to know what's happening at the local level. And we're happy to have with us today Lottie Ferguson, who's the Chief Resilience Officer for the City of Flint, to give us an update. Good afternoon, Lottie.
Good afternoon. Can you hear me okay?
Yes, we can. You're out and about, right?
I am out and about. I'm actually out downtown right now with the mayor at the Flint Food Truck Festival, and we got Gus Macker tournament going on this weekend. There's a lot happening this weekend, so get out and have a good time. What I wanted to talk to you about today is, you know, COVID has certainly taken a toll on mental health of all involved. And so we are happy that we can finally announce that the City of Flint was awarded a renewal grant for Flint Recast. We've received funding for an additional 5 years at $1 million a year from the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration. So Flint Resiliency in Communities After Stress and Trauma, or Recast, aims to assist high-risk youth and families by supporting the recovery and rebuilding of our vibrant community through resilience and equity. So nationwide, only 9 projects were awarded, and there were only 3 of those projects that were previously awarded. So we're really proud of the work that we've done in Flint, and we're happy to continue that work. Some of the work that will be continued will be continued support of we want to support the capacity of the North Flint Revitalization Initiative, Illuminating Community Change Project at Hamilton. We're going to continue the community-initiated trauma-informed mini-grant programs. We're going to continue the Flint Community Advisory Task Force on public safety in partnership with the Mayor's administration and the Flint Police Chief. We will continue behavioral health training, included ACEs, mental health first aid, psychological first aid, question response and persuade. We will continue the Mindful Initiative, utilizing many of the evidence-based programs to build critical social infrastructure needed to live into our vision and serve in 5 critical areas: health, civic, education, business, community. And we will continue mindfulness integrated sports, equipping coaches and being responsive for youth needs while instilling the importance of self-regulation and integrity for student athletes. Some of our key focus areas will be promoting the use of trauma-informed practices, building capacity for youth support and development opportunities, helping to develop a vibrant community, improving access to behavioral health services community-wide. That's a big one. Expanding our trauma-informed first responder community, increasing capacity and enhancing the ability of community organizations to serve, employing evidence-based, comprehensive approaches that address the factors that impact violence. This is a huge grant for the City of Flint. We are incredibly grateful to have this opportunity again. You'll hear a whole lot more about this in the coming weeks and months. There will be, as I mentioned, a mini grant program that we are hoping will increase the capacity of our community partners to do this work in partnership with the city. Our primary partners in this: Greater Flint Health Coalition, CREM, GHS. We want to thank you all for your support. At Michigan State University, I can't leave out Dr. Deb, because we would not be able to do this again without her support. Thanks. Thank you so much. If you've got any questions about Recast, you can, flintrecast.org is the website, and you can also check out all sorts of really, really cool information. If you follow Recast on Facebook, there's always good tidbits of information that you can find to help support your mental health and help you support the mental health of those you serve.
Thank you so much, Lottie. That is great news for our community and really feeds into some of the other conversations we had over the months. And we look forward to learning more. And I know we will. If Afton's involved in it, we'll learn more about this partnership and what it means to our community. Thank you again. Now, so many of you have asked over and over again, you ask about the contagiousness of the virus, and we have our resident expert, Dr. Susan Wolford, who's going to come on and give us a better understanding for understanding this contagious Delta variant. Dr. Wolford.
Thank you so much, Yvonne, for this opportunity to speak again about the Delta virus. So you asked me if we could do an encore presentation about the Delta virus. And so that is what I'd like to do at this time. Tell me if you can see my screen. Can you see it pretty well?
Yes, yes.
Okay, excellent. So we're going to talk about the Delta virus today again, because of course it is impacting so many people. So if we think about the fact that we had the original coronavirus and now we have the Delta, I want to go back. I want to go way back to several months ago when we talked about how mutations and variants occur, right? So what we know is that viruses, which have that outer fatty layer and then the information on the inside that tells the virus how to make itself, or a cell how to make it, that's all it does. But then it makes copies of itself. That's what viruses do. They make copies of themselves in our cells, that they hijack our cells and take over our cells to make copies of themselves. But what happens is sometimes when they make those copies, they make a mistake. And the mutation is that change from going from the green dots to going to blue dots. That shows that that's a mutation. It made a mistake. And it can make those mistakes. When it makes those mistakes, that creates a variant. Sometimes it makes a mistake and it makes the virus even less effective, and it dies more readily. But sometimes it makes a variant where it makes a mistake. And like in this case, it went from, to the pinks. That change instead made a variant that is much stronger. And so that is what's happening here. So if we recall that when we think about coronavirus, that it has the spike protein. And you remember that spike protein is really important because it acts like a key to unlock our cells, but it kind of just jiggles that lock open. But sometimes when you get a variant, much like this Delta variant, what it does this time is it changes that spike protein in such a way that now it is a perfect fit. It's a really good fit for other locks on our cells. And so it can open up those cells much more easily and let the virus get in. And that's what we're seeing with this Delta variant. The way in which it changed that spike protein was in such a way that it made it easier for it to get into our cells, particularly the cells in our upper airway and respiratory tract. So this impacts a very important number, the number of people that each sick person can infect. So this number is called the R0, the R0. And for influenza, we think it's about 1.3. So every sick person will infect about 1.3 other people. We think for regular COVID, it's about 2 to 2.7 people that regular COVID would infect. So let's look at the numbers. Remember, I pointed this out, that if we think about one person infecting 1.3 people and those people infecting 1.3 more people, and we go and do that 10 times over, we'll get about 56 people who would get sick from one person who has the flu, who doesn't stay home and doesn't, work from home and has to go out. If, on the other hand, we have an R0 of 2 or 2.7, like we think with the original COVID, that one person after 10 rounds would have infected over 2,000 people. Hence, it is so important to go ahead and quarantine when you think you might be sick. But here's the thing about Delta, it's not 2 or 2.7. We think that its R0 is somewhere between 4 and 6. So many, many more people. I couldn't even show it on the kind of graph that we had before. But if we did something similar and we looked at the regular COVID on this scale, you could see after about 10 generations of this, you would have that very little line at the bottom there. That would be how many people would be infected. That's several hundred over, actually several thousand. It's over the 2,000. That's the 2,000 people that would be infected. But if we now think about Delta and do a similar modeling with the R0 being 6, you see millions of people who end up getting infected. So it is just so much more contagious that we have to be really very, very careful. And why is it more transmissible? So as I said, remember, it gets more easily into our cells. And when we compare where it stays and how much of it, COVID gets into our airways. But with Delta, more of it stays in our nose and airway. And so there's so much more of it that when you cough, sneeze, breathe, it just spreads so much more easily to everyone else. And then once it spreads to people, not only is it more likely to get them infected, because it's more likely to get into our cells. Again, it's like if I would pick this lock with a hairpin, I might get it open, but it won't be as easy. But if I open the lock with the key that goes with the lock, it's a much easier process. And it acts like it is the key. And so it can get into more of our cells, not just our lungs, but our kidneys and all the other organs that have that same lock on it, and make us much more sick and much more likely to have a severe course of COVID, which is why we should all get those layers of protection, the vaccine, wash our hands, wear our masks, stay physically distanced, and stay safe.
Thank you so much, Dr. Wilford. And that was perfect timing with those perfect reminders for us. So hopefully this has helped many who've asked that question to get that visual in their mind so that they understand the importance of masking up and following those other layers of protection. So again, thank you, Dr. Wilford. As we prepare to close our webinar for today, I just want to remind you that this afternoon, immediately following this webinar, we have, let me say this first. We want to remind you this is National Hispanic Heritage Month. Started yesterday, the 15th, on the 15th, going through October 15th. So we just want to be mindful of that. There may be some out and about activities during National Hispanic Heritage Month, but like every activity that's going on, even with what was mentioned for downtown right now, let's be sure to follow these protections. So let's be mindful of that. We also want to remind you that immediately following this webinar, there is a community academic research engagement series. It happens every other month. You're welcome to register. And today, they're going to be talking about some issues relevant to a program, a research project that happened, right, some of it right here in Flint, statewide parental perspectives on COVID. There was a survey that was done, and they will be interpreting those results as well as spotlighting another activity that's going on, looking at interpreting prolonged sitting with activity at home. And so we're trying to make sure that the research that's happening here locally, we're informed about. So please join that community academic research engagement seminar immediately following this webinar. We also want to remind you, our community health workers and our social workers, there are continuing education credits for you, as well as contact hours for social workers. Please be sure that you apply for those and help us to know whether these are beneficial to you or not, because it helps us to know how much longer or how far that we should go with making sure that these are available to you. Let me remind you again that every week we ask you to like us on Facebook. This just helps us to get more of the word out about the programs and services that are available and allow individuals to see the presentations that are made during this webinar. So like us on Facebook, subscribe to our YouTube channel, Healthy Flint, and please continue to email us any questions or any information that you might require be interested in, email us at info@hfrcc.org so that we can provide that information for you. And lastly, always give us a call at 810-835-2130, and we'll be happy again to respond to you. We look forward to seeing you next week right here for the Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus. Be safe, enjoy the day, and let's make sure that we are sharing good information that's credible with other members of our community. Thank you for joining us.